Hospital costs account for about a third of all healthcare expenses.
But as Local 12 troubleshooter Howard Ain reports, it can be hard to decipher the charges when you get your hospital bill.
These days, many of us have high deductible health insurance policies to keep premiums down. That means we're responsible for a large portion of our medical bills. But how do you know what you're really paying for? That's a question Roger Ullrich of Delhi Township asked earlier this year after he ended up in a hospital emergency room suffering from stress.
I said, there's no injuries. I said, this is something's going on here with my nervous system, and it's just something stress related.
Ullrich was taken to the emergency room at the closest hospital, St. Elizabeth in Edgewood.
So I sat in the chair, and the nurse came in, and I gave them a urine sample. She took a blood pressure, and we waited a bit. She talked to me for a few minutes.
Soon a doctor came in, examined him, and gave him an anti-anxiety pill, then sent him home. Ullrich was very happy with the care and quickly paid the $101 doctor bill. But the hospital bill was a different story.
It was just a little bizarre as far as when I got the bill for $947, and then it's even more bizarre when they can't detail it for me.
The hospital bill simply states total charges $947. His insurance covers part of it, but Ullrich has to pay the rest.
What other business or service can get away with something like this without detailing? I asked him, I said, where does $947 come from? They couldn't tell me. I said, mine should have been on the very lowest level of whatever service. And she said, well, that is the lowest level.
But I checked St. E's published list of emergency room fees and found Ullrich was not charged at the lowest level of care. He was charged for a level of care which would be given to a heart attack patient. Remember, he only sat in a chair, never even laid on a bed, never had an EKG check of his heart, and feels he was overcharged.
You expect them to treat you not only well, but to treat you fairly on the billing as well. So they treated me well, but they didn't treat me, I don't think, fairly.
A St. Elizabeth Hospital spokesman declined an on-camera interview, but says the hospital is now conducting a review of the fee charged Ullrich. This is a reminder to always ask for a detailed copy of your hospital bill, carefully review it, and challenge any mistakes you find. Howard Ain, Local 12 troubleshooter.